AcuPulse in my clinic for several years, and compared to other fractional CO2 lasers, it has a much better ablation versus coagulation ratio. So relatively there is more ablation and less coagulation, which is very good for fractional ablative resurfacing, because in this way we can treat deeper wrinkles without the risk of side effects, because you're really going deep without getting too much collateral heating on the sides. So which means that actually we get very nice results at lower energies. Already at 30 millijoules per centimeter quadrant, we get 1 millimeter of depth, which is the right depth to treat wrinkles. So you actually don't need more than that. So you already get the depth at 30 millijoules. And on the other hand, you don't have so much collateral heating, so we don't have side effects. Side effects that can be seen are late hypopigmentation, actually delayed hypopigmentation. I've seen it with other fractional lasers, and I haven't seen it with the AcuPulse. And for me, the reason for this is this ablation coagulation ratio, which is great, using lower energies to get fantastic results without risking any side effects. The other problem with the other fractional ablative lasers is actually the downtime that patients get. So because we're using lower energies, we actually get a little bit less inflammation, a little bit less redness, and also the period after the resurfacing, after actually finishing the 5 days at home, they will have less redness. So their skin will be just a little bit pink, but not red like with the other devices. So actually healing is faster and less risk for side effects. Safety margin is higher up, and it's very important to be safe. So you're deep on the one hand, which is great to get fantastic results, and on the other hand you're very safe to not get the side effects such as the healing time, which is quite long with the other devices, or a little bit longer, and also the safety for long-term side effects, such as permanent and delayed hypopigmentation. We have a lot of sun and a lot of sun exposure, and many people suffer from a lot of sun damage. So they have a lot of wrinkles, a lot of sunspots, a lot of solar lentigens, and actually they all need some skin resurfacing. So they will come and they will say, what can you do to rejuvenate my skin, to make my skin look younger? I want to look better, to have a smooth surface, to have an even skin tone. What can you do? I propose to many patients the AcuPulse. And the reason for this is that I can give with one treatment, with one fractional CO2 treatment, tremendous results, fantastic results. They will stay 5 days at home, so the downtime for patients nowadays with the CO2 is 5 days, and after 5 days they actually peel. There is kind of a peeling of the skin, and they will have very nice skin. So they're actually quite happy about it. Mostly patients will ask for facial rejuvenation, but the great thing about the AcuPulse is that I'm also using it off the face. I'm using it also on the neck and on the décolleté. When I'm doing the facial rejuvenation procedure with the AcuPulse, I will also always treat the neck. I'm using then the superficial mode, and it's very nice. Patients like it very much that they're getting also the neck treated. Also, this is something that we couldn't do in the past. As you know, when we were doing the ablative rejuvenation, the ablative resurfacing, we were nearly not treating the neck because of the risk of scarring. We don't have it now with this new device, with the superficial mode.